Hi, so I'm Jessica and I'm an occupational therapy student.
And I'm Gabby, and I'm an occupational therapy student.
Hi, I'm Oswa, and I'm also an occupational therapy student.
Hi, I'm Hamani Modi, and I'm a CODA.
Hi, I'm Alicia Moore. I'm a CODA.
Hi, my name's Ray and I'm a PTA.
Okay, so to start, Alicia, I'm going to ask you a few questions about your therapy assistant responsibility. So, can you describe your current or most recent position as a therapy assistant? What was your role, and what kind of practice setting did you work in?
So I am a CODA in a private school for kids with autism, and I provide direct one-to-one therapy.
Awesome. And then, Hamani, which state are you currently practicing in? What specific regulations must you and your supervising therapist adhere to? And how do you ensure that you comply with these regulations?
Um, so currently I work in New Jersey. So the regulations that we have to follow include licensure and supervision regulation, scope of practice regulation, making sure that we collaborate and communicate with our supervising OTs, and then continuing education as well. And the way that we make sure that we adhere to them is by holding monthly meetings. At my job, we sit down and we talk about any concerns that we have for clients, any updating on continuing education requirements. We try and collaborate and communicate on patient care to make sure that we have safe and effective treatment interventions.
All right, thank you, Hamani. My question is to Hungry. Have you ever been asked by a therapist to do something that was out of your scope of practice as an assistant? If so, how did you handle that request?
So I would say I was working in a skilled nursing facility as a PTA, and I'm a bilingual therapist assistant. So I think the most occasion that I met is the other therapist might ask me to help to translate. It's
Oh, yeah,
actually not written in the scope of the practice,
right.
but I do my best that I can to help my coworker to improve the teamwork efficiency.
Well, that's very nice of you either way. So even though it's not in our scope of practice, what is, I guess I'll ask, Alicia, what is the best piece of advice for working with and supervising assistants and developing a good rapport as a new grad occupational therapist?
Asking questions and just really trying and getting the hands-on experience. Um, it's definitely scary at first. Um, especially when you're a new grad, they're like, you're free.
Okay.
So definitely like asking your supervisor, hey, like, can you show me this? I don't feel comfortable with this. And that way they know like what you're comfortable with, what you're not comfortable with, and they can teach you and, they can show you the ropes until you feel confident, it makes you a stronger therapist. Um, and yeah, I think asking questions 100%. And it helps you build that rapport.
That was very good advice. Thank you.
Okay, so, Humani, how long have you been an occupational therapy assistant? And if you could just briefly describe your other job positions that you've held?
Sure. So I've been an occupational therapy assistant for about 2.5 years now. And before being a CODA, I was a behavior technician and used a lot of ABA techniques. And then prior to that, I was a pharmacy technician. So I've been a little bit all over the place, but still helps me. I feel like a lot of these jobs are still relevant in what I do day to day.
Yeah, definitely. Nice. Um, and now, Alicia, could you describe your schooling and preparation to become a therapy assistant?
Yeah. So I decided to become a CODA in right before the pandemic.
No.
So I did a bridge program. So I did weekend classes, and I've always had the passion of helping people. My previous positions were central planned coordinators and a DFP. Um, and I think that helped prepare me to become a therapy assistant. And the schooling definitely helped. It was more guided. My professors were amazing, and I just learned a lot.
Nice, thank you.
I just have a question for Hongri as well. What is your favorite part about being an assistant, if you don't mind answering?
Um, I would say the favorite part for me to working in a SNF setting is to treating the patient, to get along with the patient. You will see a lot cute patient. You will see a lot stories behind them, different personalities. Yeah, I feel glad that I can work with different people and have that interaction with them and help them to get progress.
Nice.
Okay, so moving on, we have a couple more questions. I'm going to start with the first one. So I'm going to read the question first. So we need to provide an example of when you witnessed or were part of a supervisory situation as part of employment. This includes any position, is not just limited to OT. So this situation actually occurred when I was a lead pharmacy technician. So not as an not as a coda, but I had to supervise a new hire and show them the role and responsibilities of what a pharmacy tech does day to day. So I had to show them how to read prescriptions, insert them into the system, count the medications, and locate them, and then how to manage the register with the customers as well. So that was definitely one supervisory situation that I remember that required a lot from me.
Nice.
And then, yeah, go ahead.
Yeah, so I also had actually a story similar to this one. I can answer this question, but a long time ago, like 4 or 5 years ago when I was in high school, I worked at Dunkin', so I was a shift lead. I wasn't really like a supervisor per se, but I was just kind of a shift lead. So when the manager would leave, I would be like the next supervisor in charge, right? And I didn't realize this at the time, but the strategy I guess that I was using was always to motivate people. So we learned a lot about motivation and how it's important for a supervisor to motivate their coworkers. And so in the moment, I didn't realize I was doing this, but I remember being like, guys, we are responsible for making coffees, and we don't realize this right now, but we are so important in people's lives because we could literally make or break a person's day, right? Because if their coffee's good, then they're gonna have a good day. You know what I mean? Like this is something that people look forward to. So intrinsically kind of motivating them to be like, hey, you matter, you have a purpose, right? Like bring all your energy into this. And that was kind of like my one strategy that I was like always like, promoting it while I was a supervisor. So I guess that's my story going off of that question.
I love that story. That was great. I'm all about motivation.
Yeah.
Um, I also wanted to participate in this question. So a while ago, I was a residential coordinator. So I supported adults with disabilities, and it was the time the company that I worked at, we were working on our license. And our clients had like daily notes that all of the residential coordinators had to document. And my supervisor had noticed notes were missing, and she had asked me to document on those days. And those were days that I might not have seen the patient or the client. And I told her no. For me, that took a lot of strength and courage to tell my supervisor no. But I didn't feel comfortable documenting on anything that was not present. Like I couldn't recall that day. I was like, I'm not putting any documentation in. I was like, I'm sorry, like there's nothing I can do. Um, and I got a lot of kudos for it because not a lot of people would stick up to her and say no. So yeah. That was it.
You did the right thing.
Right?
Yeah, good for you. So the next question is to provide an example of when you have witnessed a leader in action. This could be any type of context. So my example was I in undergrad, I was a part of a research team, and the professor was our leader. And he, again, at the time, I didn't notice this, but through learning this class, I realized that he had implemented a transactional leadership theory. Um, he was very um, helped us like helped us meet our goals and was kind of leading us uh through like we're doing this for this reason instead of like that was how he motivated us. And so it was successful because it kind of made us respect him. And also it motivated us to meet these goals and deadlines. And yeah, so
Okay, so going off just with this question, a time where I witnessed a leader in action was with my high school basketball coach. So my team was struggling like midway through the season. We were losing a lot of games and like the overall energy on the team was low. And so my coach recognized this. And so instead of just like going to practice and doing drills and stuff, she ended up like doing team bonding exercises to like boost our confidence. So she held individual meetings as well with each player to like listen to their concerns and like gave feedback and set goals for each of us. And so she showed effective leadership by addressing both like the emotional and technical issues that my team was facing. And in this example, she used situational leadership by adjusting her coaching approach to focusing on team building to meet the needs for her team.
Excellent.
So for the last question, identify and describe at least 3 factors that determine and influence what the OTA is able to do and or not to do. So I would say the first factor would be the state regulation, because each different state might have different regulation laws that the OT and OTAs need to abide with. Uh, and the second factor, I would say the different faculty policies. For example, in the skilled nursing facility, uh, they might require like direct supervision or face-to-face supervision in order for the OTA to implant their treatments. But for the home care setting, uh, there might not be required like direct or face-to-face supervision for the OTAs to implant their treatments. And the third one, I would say experiences and the competence between different OTA might affect what they're able to do and not to do. For example, a quota with several years of experience and advanced training may give more responsibilities and autonomy compared to a newly graduated OTA.
Excellent.
So, so I'm just gonna ask, can Hamani, Hungry, and Elisa answer this question for me? What is the most rewarding part of being a therapy assistant?
Well, for me, it's really seeing the growth, I'd say. We're really working directly with the patients on a day-to-day basis. And I get a lot of joy from seeing clients come to me with certain deficits and then watching them grow from that and improve. So that's what I enjoy most.
I'm going to piggyback off of Hamani. I think that's like my favorite part is working with students and seeing how much they grow and blossom and different tasks, working on ADLs, things like that, and then just seeing how much their independence grows. It's wild.
Yeah, like I mentioned before, I enjoy to work with people and seeing different people, and it's very interesting. And I would love to see their progress with the skilled intervention. And at the end of the rehab, uh, at their end of the rehab, when they reach more and more independence, you will feel your job is very meaningful and valuable.
Thank you, guys.
Thank you.
Thank you.
So I'm just going to ask one more question as well. So whoever would like to answer, could you describe the logistical aspects of your typical working day, such as documentation, productivity, team meetings, things like that?
I'll touch base. So for documentation, in the school setting, we have documentation in our databases that we have to implement. How much assistance did they need? And sometimes the parents want us to like write a note on, like what did they work on? How much prompting did they need? And then we don't have any productivity there's no percentage that we have to hit. And then team meetings, it depends, if it's an annual, team meetings happen every once in a while. If it's something urgent, then it happens a little bit quicker. But the OTs and the codas meet pretty regularly and bounce ideas off of each other. So that's what a day looks like.
That's interesting. Thank you.
All right, well, I think that's it for the questions that we have, right? Thank you guys so much for giving us the insightful answers, and thank you for meeting up with us at this time. I know it was hard, but thank you so much for giving us such great answers and knowing what we have to look forward to, because I personally have not been in like the OT like setting specifically per se, besides fieldwork, obviously. So I'm really excited to, this made me kind of look forward to working as well.
You're
But
gonna
thank
love
you.
it.
I am sure I will.
Thank you, everyone.
Thank you.
Thank you.
Yeah.
Thank you.